Depending on someone's anatomy, there are a couple of different technical paths you can take as far as how we're keeping, what patterns of tissue we're removing, what we're keeping, where the blood supply, the nerves, and all of those things sit. There are a couple of options as a surgeon, and looking at somebody's anatomy and their measurements and things like that, you may pick one over the other. I'd say probably some surgeons do exclusively one, some do exclusively the other. I do mostly one pattern, but there are definitely, you know, every couple of months or every month to 2 months, I'm doing another pattern, and it's sort of patient dependent. Yeah, but in general, you should be able to remove enough tissue to reach the goals through any of the patterns. Sometimes you're trying to save a little bit of scar length, shortening the scars a little bit. But most of the time, if you really want to get a good, consistent shape, get things lifted appropriately, maybe the width narrowed, get the shape and everything, most people benefit, in my opinion, by getting what oftentimes people will talk about an anchor type incision, or it's technically called a wise pattern incision. And that just involves an incision around the areola, one that goes from the areola to the base of the breast, and then one that kind of hugs the bottom of the breast where an underwire might sit on a bra. And the nipple itself stays the same size unless there's a reason to change that. If that were large and we're wanting to be reduced as well to make it proportionate. But for the most part, the nipple stays the same and the areola is smaller. We have photos on display at portlandplasticsurgery.com, also on our socials. And if you come into the office at any time, I can show you a list of before and after photos of folks who maybe weren't even comfortable with them being out in social media or out on the computers, but that are really happy with their results and happy to share with prospective patients.